Good evening. Good evening to you.
Good evening.
Uh, Good evening to you all. I'm Devika Desoria, Chairperson of Women Engineers Forum of Institution of Engineers Sri Lanka. Thank you all for joining with us today to learn about airborne transmission of COVID-19 virus on office workplaces. Our resource person is Professor Mahesh Jayavira. And just to announce that this webinar is jointly organized by the Women Engineers Forum of ISL and the Section C of Sri Lanka Association for the Advancement of Science. And just for your information, we are going to have a lecture for about 1 hour and 15 minutes, and it will be followed by a question and answer session. Your microphones will be muted during the lecture, and you can type your questions in the chat. And also, there's a kind request not to share the screen, only the speaker will share the screen, and please don't open the video, please be on audio. And end of the lecturer will answer your questions, and the Q&A session will be moderated by Engineer Kushni Senaratne, Vice President of Women Engineers Forum. During the question and answer session, please keep your own devices muted to avoid the background noises. Without taking much time, I will invite Dr. Shiromi Karunaratne, President of Section C of Sri Lanka Association for the Advancement of Science, to introduce today's speaker. Thank you very much. Dr. Shiromi, over to you.
Thank you very much, Devika. Good evening, Professor Mahesh, and good evening to all of you. It's my great pleasure and privilege to introduce Professor Mahesh Jayavira today, our resource person. Professor Mahesh Jayavira obtained his Bachelor of Science in Civil Engineering from University of Moratuwa, Sri Lanka, and his PhD in Environmental Engineering from Saitama University, Japan. He carried out environmental engineering related collaborative work with more than 10 countries, and he is at present works as a professor in environmental engineering at University of Moratuwa. He is a corporate member of IESL, and he has been engaged in different environmental engineering related tasks for more than last 30 years. He worked as an advisor on environmental related work for the Ministry of Megapolis and Western Development Sri Lanka. He has carried out research in diverse areas and published more than 70 journal and conference papers. He presently helps avert risk involved in aerosol generation procedures related to the COVID-19 virus by estimating the risk of transmission in indoor settings and providing an engineering solutions. Over to you, Professor Mahesh Jayavira. Over to you, sir.
Thank you very much. Let me share the screen. So I do believe that you can be able to see. Okay.
Yes.
So, all right. Thank you very much. And first of all, my thanks first goes to Engineer Devika and also Dr. Shiromi, and especially for Professor Mrs. Niranjani Ratnayaka, who invited me to do this presentation. So right at the moment, I have been doing in many places, but this is actually the good forum where I can throw out my ideas with respect to the transmission, particularly the airborne transmission of COVID-19 virus. And all of us work in workspaces, and then it's no doubt that everybody has to report for the work, after a couple of months of lockdown. So let us see whether we can be able to have any idea as to how we could control this airborne transmission. So with that, I would like to start off my lecture, and this is just to give you a glimpse of statistics. what I want to share here would be the, what I have, highlighted in red, right? And that most of the cases that have been in fact, reported in the world, 99% are in mild condition and only 1% in critical condition. What does it mean? That many people take it for granted, particularly in the Western countries. Whereas when it comes to Sri Lanka, the conditions are completely different. So I'll talk that a little later. So because of this condition where most of the cases become mild, people do not take it pretty serious until it becomes a pandemic. So that is what has happened in the world when you look at the entire casualties up to now. And when you look at the history of this pandemic, this is not the first time that we have faced with this type of pandemics. And if you look at, you can be able to say over history, so we have been having quite a lot of similar viral pandemics. We are right here. We are right here. So see, we have passed quite a lot of different episodes of pandemic over time. And when you put, all these pandemics in terms of death toll we have had up to now. So right at the moment we are here. So you may not be able to see even this size of the bowl because the size represents the death toll. So if you look at most of, these smaller ones, which always, gives you a little death toll. So that's what it says. But if you look at the time, you could say that after 2000, we have had couple of pandemics. So therefore what it says, in future, we got to believe that there may be more of this type of pandemic that are quite plausible. So therefore we have to be very, very vigilant. Going to our topic, what will happen in the workplaces? One has to be, careful of the what is called this transmission by asymptomatic and pre-symptomatic patients rather than the symptomatic patients. When you say asymptomatic, now when you look at the asymptomatic, this definition given, anybody can transfer the disease to another without showing any symptoms. So such a person is usually called asymptomatic person. Again, we have another set of people who are called pre-symptomatic. It is mainly because of the fact that they spread the disease without any signs and symptoms, but later they will show up with some signs and symptoms. So therefore, unfortunately, we got many people within these two baskets, that is asymptomatic and pre-symptomatic. So therefore, the people have absolutely no idea whether they have contracted the disease, but they are going here and there, and then they spread the disease to others. So therefore, when you're looking at the pre-symptomatic spread, what it says is they will show up some signs little later. When you say later, how long a person can be there? So usually we call an incubation period for this coronavirus, the COVID-19 virus, would be spanning from 2 days to 14 days, meaning that even after 14 days, you can show up some signs. But when you look at the mean value of all these cases up to now in the world, the mean value would be 5 days, meaning that you will be showing the signs and symptoms just after 5 days. But what is most important is the amount of virus payload that any infected person spreads out or sheds. That is found to be very high during 3rd day and the 4th day, right? Even though they start showing their symptoms 5th day, but the most of the viral payload that comes out from this mouth is quite high during 3rd day and the 4th day. So that is what people have found. But the question is, can these two groups spread out this disease, what would be the percentage? The answer would be nobody knows yet. Nobody knows yet how each and every category spreads out. So if you look at the Sri Lankan scenario, so that is what you see in this, whatever the graph given here, you can see green color is basically for asymptomatic patients. The other color, brown color, is for symptomatic patients. So see, up to 3rd June, so the Ministry of Health has given these statistics. You can see that most of the patients are asymptomatic, right? When I say asymptomatic, I do believe that some of them may be pre-symptomatic as well, because it's going to be very difficult for you to identify whether they are asymptomatic or pre-symptomatic at the time of detection. Now, the detection is done through PCR testing, right? Now, supposing if you fail some signs, right, you can go and then get yourself tested. But there you get some signs, so therefore, so those people are called the symptomatic. But what I'm now talking is asymptomatic and pre-symptomatic. So those are the two groups that are quite common in the world, and they basically pose greater threats in workspaces. So therefore, hereinafter, what we are going to look at is basically asymptomatic and pre-symptomatic patients visiting our workplaces. So this particular matter was taken up by WHO. The most recent discussion given by the technical lead is given here with regards to the transmission by asymptomatic and pre-symptomatic patients. So please listen this, because this is what the WHO says in relation to asymptomatic and the pre-symptomatic patients.
That suggests that anywhere between 6% of the population and 41% of the population may be infected but not have symptoms, with a point estimate of around 16%. I don't want to get too technical, but that we do know that some people who are asymptomatic or some people who don't have symptoms can transmit the virus on. And so what we need to better understand is how many of the people in the population don't have symptoms, and separately, how many of those individuals go on to transmit to others. And so what I was referring to yesterday in the press conference were a very few studies, some 2 or 3 studies that have been published that actually try to follow asymptomatic cases, so people who are infected over time, and then look at all of their contacts and see how many additional people were infected. And that's a very small subset of studies. And so I was responding to a question at the press conference. I wasn't stating a policy of WHO or anything like that. I was just trying to articulate what we know. And in that, I used the phrase very rare. And I think that that's misunderstanding to state that asymptomatic transmission globally is very rare. What I was referring to was a subset of studies. I also referred to some data that isn't published. And this is information that we receive from our member states through either presentations that they give at member state briefings or presentations that are given to us through teleconferences. As you know, and as we've said previously, we convene global expert networks. And at many of those, we discuss a lot of ongoing research, ongoing studies that are there. And I was referring to some detailed investigations, cluster investigations, case contact tracing, where we had reports from member states saying that when we follow asymptomatic cases, it's very rare, and I use the phrase very rare, that we found a secondary transmission. What I didn't report yesterday was, because this is a major unknown, because there's so many unknowns around this, some groups, some modeling groups have tried to estimate what is the proportion of asymptomatic people that may transmit. And these are estimates. And there's a big range from the different models, depending on how the models are done, where they've done, from which country, but some estimates of around 40% of transmission may be due to asymptomatic. But those are from models. And so I didn't include that in my answer yesterday, but wanted to make sure that I covered that here.
Okay, so you got an idea now. So still we are debating. We have 2 schools of thoughts now, whether the asymptomatic patients could, transmit the disease to others. So what people believe is it could be between 10% to 40%. Okay. So then what we are interested is, how do you ensure that there is no next wave? Because people are now talking of, let's say, second wave or maybe the next wave. So I would be happy to, just refer to it as next wave. Let's see whether the next wave would be possible within our workspace. How we are going to look at this scientifically is that you basically estimate what you call the reproduction number, R naught, or in simple language, we call it the number is the average number of infected susceptibles per infected individual. In other words, one infected person can contract how many people in our society, right, in our population. So that number is called R naught. And it is very obvious, if R naught is going to be less than 1, you have no risk. If R naught is going to be more than 1, we have a risk. So what we are now going to do is to calculate R naught and see whether it is going to be more than 1 or not. If it is less than 1 in our workplace, absolutely you are risk free. And when you look at some of these values, over past incidences, scientists have found out different R naught values. Now say for different diseases like H1N1, it's between 1.2 to 1.6, SARS, MERS, Ebola. And if you look at the COVID-19 in the world up to now, so people have found that the R naught would be 2 to 2.5, right? That is what is given there. But this is applicable only for outdoors. In, as a whole, for the country, that would be ideal. But for indoor settings, this can go to any number. So that's why we say that even it can go over 7, because people have found, in many indoor settings, it has gone over 7. Let us look at what this number is in our workplaces later. Now we have issue. Now, given the circumstances where we contract from asymptomatic and pre-symptomatic patients, the question is, are we certain of the mode of transmission? What sort of transmission is plausible in our workplaces? We have to get answers for this question. Now, to answer this question, I just want to explain you what do you mean by this transmission of COVID-19. So different modes. Now, this is exactly I extracted from WHO. So I have never changed a word, and it could be through droplets, it could be through contact, or it could be through aerosols. When you look at this picture, so you can be able to understand. Now, let's assume that there is a person who has been suffering from this disease, COVID-19, and when he speaks out, when he does any activity, he basically sheds splatter, which comes from the mouth. So whatever the splatter that comes out from the mouth are of twofold. One is we call the droplets, larger particles. So whatever the diameter, which is more than 5 micrometer, those are basically heavier particles called the droplets. So usually the droplets fall onto the floor or maybe whatever the objects around this infected person. But at the same time, you have aerosols, which are very small particles. So these small particles will go basically in the air. They linger in the air for a longer period of time. But when you look at this person, you can see that if the person may come to the close to an infected, so that there is a direct contact. But some of these aerosol particles can go and then drop or deposit in somewhere, let's say objects. So therefore, what you can do is you basically go, without your knowledge, you touch them, and then you perhaps you touch again your mouth, eyes, or nose. So therefore, through the mucosa, it will go, and then you contract the disease. That is what is called fomite route. And also, we are worried of airborne route, meaning that smaller particles, or in other words, we call droplet nuclei or aerosols, whatever you call it, they can hang around in your environment, particularly in the indoor settings. So therefore, you are not going closer to the infected, but you will enter to a room which is full of virus. So therefore, there you are susceptible for what you call airborne transmission. So therefore, all three types are quite possible in indoor setting. If you look at what happens, now this particular picture explains you very clearly. You see that the infected person is there in an event of sneezing. What happens? He drops out large particles or the large droplets and then sheds even the aerosols. Aerosols basically goes as a cloud. Now, in the case of sneezing, the droplets can go up to 8 meters. That has already been proven. But it's not the aerosols. Aerosols can go to very far depending on your indoor setting. Similarly, in the event of coughing, it can go, the droplets can go up to like 3 meters. The aerosols can go to any distance depending on the environment. And in the case of exhaling, in simple breathing, it can go, the droplets can go to 1 meter maximum, but the exhale air with aerosols can go far. So this is where we come out with this social distancing of 1 meter, because basically people exhale, so therefore it can go up to 1 meter. So therefore, if you are going to be little far from 1 meter, people believe that you are somewhat safe. So therefore, remember, that's how we come out with this social distancing of 1 meter into the picture. So what we need to do now, we know that there are 3 types of transmission. You got to get yourself prepared to prevent from transmission for all 3 modes. When you look at basically indoor, and we believe that the next wave could be highly possible or virulent in indoor spaces. Now this is what happens. Basically, people in your indoor workplaces, they speak, they laugh, they giggle, and then they do quite a lot of activities which always bring out a large amount of droplets and aerosols. And then we have basically 2 parts. First one we call direct. What do you mean by direct is you are much closer to this infected person. Then it comes straight away to you. Then we call contact transmission by droplets. You will contract the disease directly. So this part is the most prominent part as per the WHO and as per many scientists. So therefore, that is why we need to be, in fact, prevented from this particular transmissions. What you do, basically, you wear masks. If you wear masks, then you can be able to, basically get rid of the direct transmission. But in the meantime, you get indirect as well. Indirect is you are not directly exposed to the person, but this person, you can see that they shed lots of droplets on the floor, maybe on the objects. You go there and then you basically touch and it can come to you. So that is where you use hand hygiene practices in many occurrences. That is basically to get rid of fomite transmission. But the question comes from this: airborne transmission. Are we prepared, or have we taken any interventions to get rid of air transmission? I mean, to answer you, not really. So therefore, we believe that the airborne transmission by aerosol would be fairly high. So therefore, that is where we have to pay attention when it comes to our workplaces. The question arises, is airborne transmission real? Why I'm asking this is still WHO doesn't believe that this is real. As a result, what happened? Early of this month, 239 scientists, all world leading scientists, headed by this person given here, Linida Moreswa from the Queensland University of Technology. She is the #1, or I would say the leading scientist behind the entire scene. And these people believe that the airborne, the transmission is real. And if you look at the papers, there are quite a lot of papers have now come out. Some of them I have put here, so you can be able to read later. You will understand how bad this is. And now, as of day before yesterday, WHO has accepted to a certain extent that the airborne transmission is real. But at least now they have come to a bit of a compromise. But still they have not 100% agreed on this airborne transmission. But scientists have been working quite a lot and coming out with new, these scientific evidence. So therefore, we can be able to say, but there are plenty of evidence have now come out from the world. If you look at this, now this is the most recent, the debate and the interview given by the same technical lead of WHO, and listen very carefully what she says now. Earlier you have heard something with regards to asymptomatic and pre-symptomatic. Now see what she has to say about the airborne transmission.
Yes, we have been engaged with this group since April, when they first wrote to us on April 1st. And we've had an active engagement with them and with many of the signatories on this through different networks. And as we have said previously, we welcome the interaction from scientists all over the world, from many different disciplines. Many of the signatories are engineers, which is a wonderful area of expertise, which adds to growing knowledge about the importance of ventilation, which we feel also is very important. We have been talking about the possibility of airborne transmission and aerosol transmission as one of the modes of transmission of COVID-19, as well as droplet. We've looked at fomites, we look at fecal oral, we look at mother to child, we look at animal to human, of course, as well. And so we are producing a scientific brief on summarizing where we are. We've been working on this for several weeks now, and we've engaged with a large number of groups, epidemiologists and clinicians, IPC specialists, engineers, mathematical modelers, to try to consolidate the growing knowledge around transmission. But we have spoken about the importance of all of the different potential modes of transmission. This is a respiratory pathogen, and so it is important that what we know fits into the guidance that we have, which is why a comprehensive package of interventions are required to be able to stop transmission. This includes not only physical distancing, it includes the use of masks where appropriate in certain settings, specifically where you can't do physical distancing, and especially for healthcare workers. So our focus on the use of masks, of course, is for healthcare workers, and to use airborne precautions where you have those aerosol generating procedures. But we're also looking at the possible role of airborne transmission in other settings where you have particularly closed settings where you have poor ventilation. So we will be issuing our brief in the coming days, and that will outline everything that we have in this area.
Okay, so you heard now, so to a certain extent, they have now believed it is possible. Now, this is the Sri Lankan situation. Now, for the first time, you would be seeing this graph, what we have in Sri Lanka, and with my, team of students, I managed to, get, and it took 2 weeks for me to, come up with this one, because I had to, listen with my team, everyday news and then collection of data to, come out with this graph. Look at where we are in Sri Lanka. So we started the first patient from 11th March, right? 11th March we started, and then you look at the, whatever the orange color, we call the locals in the community. So what we found is in the local community, and we get very little, and then what happens, then what comes is arrivals from the overseas in the quarantine centers. So therefore you can say this blue color also started climbing up. And then all of a sudden we have locals in the quarantine centers, because we have had quite a lot of good interventions to stop this spreading, for which what we did was we started quarantine centers. So most of what you find in this local community have been transferred to quarantine centers. So therefore, within the quarantine centers, you come out with some other, let's say, second generation or third generation. All the next generations are found in quarantine centers. That's why you got this, purple color going up. Okay. And even here, when you come to 27th March, little locals found in community. But as soon as we find locals in the community, what we do is we transfer them to the hospital, and then we do what you call the contact tracing. Through the contact tracing, we find basically all the second generation people or who have had some close contacts with the patient, and we transfer all of them into quarantine centers. That's why you get quite a lot of patients from quarantine centers here, right? You can be able to say that you get a lot of people in the quarantine centers. And then what comes is, after that, you can see this locals in the community is very minimal. Look at this, whatever the orange color. So that is a plus point for Sri Lanka, because as long as you find very little in the local community, meaning that you have suppressed the situation. So the second generation or the third generation would be impossible. But what will happen when 24th April comes? So during this period, you can see that we have another climbing, the mounting people, they are from Navy cluster. You can see that all this yellow color are from Navy cluster. When you look at Navy cluster have not given anything here for the next generation in locals. So locals are not sick during this period. See? So that is the beauty of Sri Lanka. Even though you found, higher numbers of patients in Navy cluster, so as soon as people are, found, what happens was the entire Valisara Navy camp was isolated, and then no person is allowed to go and see, or no person comes out. So because of this lockdown or the isolation situation, so whatever the contribution towards the local became minimal in this area, right? But what has happened here is, you can see even here, there are some, people from the Navy cluster, because within this cluster, they have transferred to the couple of other generations. So therefore, if you look at this very clearly, this cluster, you can see that this could have been possible only if all this, let's say the sailors or the Navy officers who are there are exposed to the internal, or I would say the environment which is not outside, which is basically interior, or in other words, they are within the indoor. So therefore the transmission has taken place basically within the indoor setting. So therefore most of the people got sick. So therefore this is one of the evidence for us to believe that the airborne transmission is real. And then what happened? Then we get lots of arrivals from the overseas, right? From the overseas, and they have been stationed in quarantine centers. So in that, they have become positive. So that's where you get this blue color, right? So they are blue color. But look at this period from here to here, there is no any local contractor, meaning that we have managed pretty well. I mean, look at the situation in India, look at the other countries, Italy and all the developed countries. What they have reported is the locals in the community. But as far as Sri Lanka is concerned, we have had no locals in this period. So that is the success of our interventions, right? Because we have got what we call this non-pharmaceutical interventions. So that help us subdue the numbers in our local community. But all of a sudden, when it comes to July 9th, then we got this another cluster that is called the Kandakadu Rehabilitation Center. So that is what you see in a red color here. All of a sudden, they just went high. Now, this is also again in the indoor setting. This is in the indoor settings. I will let you know later why we have such high numbers even here and there. But when you look at these two clusters, one is the Navy cluster, the other one is Kandakadu Rehabilitation Center cluster, you see that all of these are from the airborne transmission, and they are related to indoor settings. So therefore, we got to believe that the next wave could be very plausible in indoor settings. When you say indoor setting, where? The place where you work. So that is why we have to be vigilant of what to do and what not to do in our office spaces. So that is where we are now focusing on. So therefore, this is a very good footing where we can start the Sri Lankan situation. So therefore, when you look at the overall picture in Sri Lanka, we are much ahead of others. Why? When you look at starting from 11th March up to 24th July, you get very little locals affected with the disease, right? So because of that, I mean, there may be people coming in, you know, they are in quarantine centers, but as long as they are in the quarantine centers, they are manageable. So therefore, we need not to be that much worried, but in the community, we subdued the numbers. So that is the success of Sri Lanka. If this continues, you need not to worry of the second wave or maybe the next wave within the community. Because our biggest issue is once you get more numbers in the community, you may not be able to do what you call the contact tracing, so that it is beyond our control. So therefore, we may not be able to identify it, because remember what I said at the beginning, most of them are either asymptomatic or pre-symptomatic. So therefore, we don't know, we will be associating people who are sick, but they don't know that they have got contracted. We don't know that they have the disease. So as long as these two are true, a next wave is very plausible. But as far as Sri Lanka is concerned, we are at a better wicket. We absolutely, you need not to be worried. But if you're looking at these two clusters, where we have to be worried is indoor settings. So therefore, that's why we are focusing very much on indoor settings. And do we have evidence for airborne transmission for COVID? Yes. Not only Sri Lanka, we have the best example is South Korea. This is actually in one of the church cluster called Sincheonjin church cluster, where a one person, 31st patient of South Korea, infected more than 7,000 people. Can you believe? 7,000 people simply by staying in a church for 4 hours. Simply by staying in church for 4 hours, 2 hours slot and another 2 hours slot, and then gave the disease to more than 7,000 people. So what happened? That is within the indoor, right? So therefore, that is why we had to be a bit worried, because the numbers are going pretty high, or we call scientifically R0, reproduction number seems to be pretty high in indoor settings. Look at the France, evidence given from the France is about 500 new clusters by July in northwestern Brittany and Maine. So this is just outside the Paris. People have, so most of them have now been isolated in France. That is why they say second wave have just started in France. And when you look at, again, another classic case is Diamond Princess ship. Everybody would have, you know, heard of this. And we have had more than 700 patients from this ship. Right? And again, when you're looking at the Italy, people say that the second wave has come because in the month of July, a group of seasonal workers in Mondragon have contracted this. Is now we have reported more than 700 particularly in the indoor setting. So therefore, there are plenty of evidence given in the world as far as this airborne disease are concerned. Why we are so worried is the numbers seems to be pretty high compared to outdoor cases. So therefore, that's why we are going to study on this. So what it means, in indoor settings, airborne transmission seems to be critical than one may imagine. So therefore, what I just want to say is, in my opinion, this could trigger the next wave. Remember, provided that you have not taken precautions. So therefore, we need to get some precautions to avert the next wave. Therefore, then you have absolutely no issue. Otherwise, we have to face with the next wave. We don't know where it stops. So therefore, this is what I just want to, you know, highlight today very much. When you are doing this, everybody knows that you wear mask. The question is, can the mask help avert contact transmission in indoor settings? Yes, the answer is yes, but with proper practice. What do you mean by proper practice? For that, you need to know this. what type of mask for your indoor settings. I'm talking of only indoor settings here. And what people use is surgical mask, N95 mask. But remember, you are not supposed to wear the cloth mask in the indoor settings. Please remember that. The other two are all right, but not the cloth mask. So then people might ask, why cloth mask? Cloth masks are basically recommended provided that you have no access to surgical or N95 masks. If you have the access to surgical or N95, please go for that. But look at what each and every type of mask does for you. Now, first picture given here is for the surgical mask. Surgical mask comes out with 3 layers. Now, what you see in blue color is outer layer. In between, we have another layer called electrostatic filtration layer, and the most outer layer, the inner layer called the inner non-woven fabric. When you wear this, what happens? Most of the virus that comes through will be retained from the first, and the smaller virus that anyway comes through this, the outer layer, will be taken up by this middle layer, and the third layer, the inner layer, is nothing to do with retention. But it says is why you have the third layer or the inner layer is to prevent your splatter going out, because that is going to be wet, or we call in technical terms soil. When you keep on talking or when you wear for longer period, it becomes wet, meaning that this mask may not be able to be used thereafter. So therefore, that is what we are worried. But when it comes to N95, you can be able to see that it comes out with minimum 5 layers. That's why we believe that the N95 mask seems to be better. And when you say N95, some people would ask, why N95? Because it's not available basically in Sri Lanka. We have what you call KN95 mask. When you go to pharmacy, you can ask for KN95. K refers to Korean standards. But when you say KN95 or N95, both are pretty same, right? When you look at this number of layers, that would be very clear. Now here you can see there are 3 inner layers which prevents virus going in. So therefore, this mask seems to be much better compared to surgical mask. When you look at what happens, there are certain mechanisms that are going to be predominant with the mask, right? And just to give you a little idea, I'm not going to be too much of technical, there are so many people are involved here with this without technical knowledge. What it does is basically the virus will come with a speed because you inhale, you breathe. Whenever you breathe, you take the virus in. When you take the virus in, the virus comes and hits some of these fibers, right? And then virus stops. That is called inertial impaction. And also there is another mechanism called interceptions. What happens is most of the virus will try to go pretty fast, but because of this contact, the speed drops. And then we have another one called diffusion, because the virus, when they go in, its velocity drops, so therefore it follows the path which doesn't have any velocity, so that there is no momentum, so that we say it goes random path, so which is called the diffusion mechanism. And in the meantime, most of the viruses has some charge. So this charged virus can go and attract to another charge which is basically in fibers. So therefore that is called electrostatic attraction. So therefore all of these 4 attractions are quite possible in your mask, right? So look at now how you prepare or how you wear mask. And when you ask regarding the mask, you basically wear the mask not to protect others, but sometimes you have to wear to protect others. Now see, that's why I say protecting others, or in other words, we call outward protection. Now if you look at this picture, no mask meaning no protection. If you have a surgical mask, you can protect others only 50%. See, what does it mean? You can see here, still the aerosol and the droplets will come out, right? Certain fraction, but not as this. Now here, if you look at the payload here, very high, but they are less. So that's why you say 50% protection is there. But when you go for N95, you protect 70% of people around you, right? If you just go for N95. And then we have another one, which is not very common in Sri Lanka. We call elastomeric respirator. That is the reusable N95 with cartridge. Some places we have, but usually you don't have. So therefore, when you look at basically in Sri Lanka, we have surgical and N95 mask. And when you look at both surgical and N95, remember, they are disposable masks. You cannot wear over and over again. So therefore, remember, the surgical and N95 respirator, they are to be always disposed after use. You may not be able to use it again and again. And most frequently, you wear the mask to protect yourself. That's why we, basically these days wear the mask. When you wear the mask, if you have this surgical mask, what you do is you protect yourself by 75%. And when you have N95 mask, you protect yourself 95%. That's how this number comes from. Okay? And with even the others same. Right? But the question is this really true? Not really. Because when you look at some of the masks, particularly N95, and I have seen most of you wear the largest size mask. Unfortunately, in Sri Lanka, we don't have the large size, medium size, smaller size. You buy N95 from the, let's say pharmacy, and it is not going to fit enough for your face. N95 mask would be to fix completely your face. If it doesn't seal, you may not be able to get what you want. So therefore 95% protection may not be there. So therefore keep that in mind. Very important thing is, if you are going to wear a larger mask, there is no point in wearing N95. In such a case, as the surgical mask would also be the same. So therefore go for surgical mask if you can't get the right size of N95. When you wear this mask, one thing you need to do is you cannot use it right throughout. As you wear this, always something takes place, which we usually call scaling or blocking. So therefore this scaling depends on the filter efficiency. So therefore I'm not going to talk very much. If you look at the scaling factor, when you look at what you see here is surgical mask. As you wear this, 60% of this mask can be blocked. That is why we say scaling factor of 60% for surgical mask, whereas for the HEPA mask, it is going to be only 3%. Or in other words, 97% seems to be pretty good for HEPA mask. This is actually HEPA mask, that is called high efficiency particle arresting mask. So this is what you see, but you hardly find this in Sri Lanka. In certain places we have got it, and many people buy, so that you may not be able to find this mask in Sri Lanka, but in the other countries people wear this more frequently, but the production is very difficult nowadays, so therefore it won't come to the market very easily. So therefore remember, whenever you wear whatever the surgical mask, 60% can be blocked. So therefore we have to keep that in mind. Sometimes some people I have seen wearing the surgical mask over and over again, many days, because what you look at is, you see whether it is polluted or maybe soiled, whether that some dirty it has been contaminated with dirt or not. But that is not the way. So therefore remember, it's very important for us to understand how long you can wear this mask. Now this is ideal paper that you can come out. French have come out with the guideline. The entire Europe is following this now. If you look at surgical mask can be worn for maximum, I would say 3 hours. People say maybe 4 hours, but remember 3 hours. But when it comes to us, what happens? Maybe 8 hours or maybe 24 hours, we do wear the same surgical mask. And when it comes to N95, you can wear that maximum 8 hours. If you look at this very clearly given, under surgical mask wearing duration less than 4. It's given here. And when it comes to the other mask, N95, it is maximum 8 hours, right? Maybe 3 hours seems to be better. Why? After that, it blocked. When it is blocked, when it particularly for the surgical mask, you can see there are a lot of leakages. Now, you wear the surgical mask, you try to wear your spectacles. What will happen a little later? You can see the mist in your spectacles. What does it mean? There are leakages. Now, when the mask is blocked, leakages become more and more. And then when you inhale, you get the air not through the mask, but from the leakages, right? And in such a case, you know, it's little difficult for you to breathe. So then what you do? You start violent breathing, right? Violent breathing, meaning that you are trying to get more and more viruses from the atmosphere, from the air. That is not through the mask, but that is through the leakages. Then what will happen? You are more susceptible for the disease. So therefore, that is why you need to maintain the wearing frequencies for different types of masks. Surgical mask 3 hours. Then the question would be, is it practical? Can we wear only for 3 hours and throw it out? Which may not be. But unfortunately, that is the situation when it comes to COVID-19 virus, right? So therefore, please remember this. And what is most important thing is to wear the mask not outside but inside. But I don't deny that it is not necessary. It may be necessary outside, but looking at the ventilation outside of your workspaces, it is pretty fast, pretty high. So therefore, most of the virus that are coming out from an infected will become airborne in no time, in outside. But when you're inside the workplace, it is not so. But what we do, and I have observed many times, when the people come to the workplace, they remove the mask and then they stay inside without the mask, thinking that that is not going to be a problem. But always the problem is so high within the indoor setting than the outdoor setting. So therefore, please remember that you should wear mask inside your workplace than outside, right? So keep that in mind. It's a very, very important part. And another question I just want to pose here is, can a use mask be a reservoir of virus for propelling fomite transmission? Yes. If you look at this picture, the last row, it says outside of the surgical mask, this virus can be viable for 7 days. Or in other words, that can be active for 7 days outside of this. So if it is so, what you have to do, never throw it in a garbage bin of your office, because droplet nuclei, that is whatever the virus that are attached to your outside of the surgical mask can be airborne, right? So therefore, this is another area where you need to pay attention, because the virus, when it attached to this surgical mask, they never, multiply. Remember, they never multiply. What happens? They decay, right? Or they basically, we say they kill by themselves. Usually we call decay. It's a first order decaying takes place. So therefore, the number is always going to be less and less. But when you look at the number that are there in the mask, they are pretty high. So in other words, we call RNA copies would be very, very high. So therefore, they can survive for 7 days. Even after 7 days, you can be able to find some live virus. That is why we have to be careful of, whenever you throw out the used mask, particularly in your ordinary normal garbage bin at your workplace. Sometimes you believe that the partitioning would help you control droplets and aerosols from an infected person. It is not so. Partitioning would not help you, but truly speaking, partitioning would aggravate the problem. Now, this is what I'm now going to show you is the modeling work. These are pretty accurate modeling using this computational fluid dynamics done in Europe and see what happens in the partitioning. When a person coughs within a corridor, see how it goes. What you see in yellow color is aerosols, blue color is droplets. Now this is only for 6 minutes. See that the person who is in the next door has absolutely no idea. He has no idea because he can't see the other side. But you can be able to see that the aerosols will come towards the other side. So then we need to be very much worried. Okay, so what I have done up to now, there is a paper that I have published with my co-authors. Please read this one. This is available in the Science Direct. You can get it free. Please read it. So that would help you a lot in combating this different types of transmission. Please read later. Then we are coming to our workplaces, work settings. But when you are coming to your workplaces, we see basically we believe aerosol generation procedure seems to be unavoidable because people speak, people laugh, people giggle. So in such case, always aerosols are produced. So therefore one cannot, speculate saying that there are no aerosols within your workplaces, not at all. So you always keep on producing aerosols in your workplaces. Hence, we need to now think of all three modes of transmission. Okay. And unfortunately, we are to work in a very restricted indoor. That is again another adverse condition that we are faced with today's context. And also we have to, basically believe that there are no easy method of identifying COVID-19 patients. Because you know that when people come in, what you do? You always check temperatures. But what happens? The temperature is going to be there if you find only symptoms. But as I mentioned earlier, so you will be getting asymptomatic or pre-symptomatic people coming into your workplaces where there are no signs. So therefore, there is no easy method for you to identify COVID-19 patients. So therefore, you got to believe that you have to deal with the COVID-19 patients even in future. And if it is so, you are subject to high degree of risk. So meaning, invariably you drive you to equip with all precautions. You have to get some precautions for droplets, aerosols, and foaming. The question is, in your work settings, are you prepared? For that, what you do is, this is what you do right at the moment, right? Some of you are doing this already, and they are basically we call preconceived ideas. And you do reinstate good practices, all type of hygiene recommended by your institution. You do that, right? You do hand hygiene practices, all of these things you do. And some people believe that a switch off air conditions would help you. Some people believe opening windows for natural ventilation would be much better. And some says that switching off ceiling fans would be the better option. Let us look at, we can find the answers for all these burning questions scientifically. To answer these scientifically, these are the burning questions that you basically ask your authorities at your workplace, right? So you need answers for all of them. The first question is, can you do away with the aerosol generation procedures? Answer would be very unlikely. You cannot stop aerosols being generated within your workplace. What happens if asymptomatic patient visits? Are you prepared? No, because no protocol for identification. We don't know. Then we ask, can you work for long hours, 6 to 8 hours in a restricted settings? Our answer is no idea. Then next one is, can you put your life on the lines? Everybody says no, not at all. We don't want to be sick. So that answer for that is very clear. Then how do you know whether you have adequate ventilation? Because this is what is most important as far as the indoor setting is concerned. And people are asking whether you have adequate ventilation. So even we being engineers, sometimes we say, no idea. Then what happens if your fellow colleague accidentally handle COVID-19 patient and becomes symptomatic? Our answer is no idea. Is there anything that you could do to prevent you from being contracted? Yes, we think wearing masks, practicing hygiene etiquettes would be enough. Remember, these two will help you only up to maximum 20%. You are at a risk more than 80%, though you do these two practices every day. So that is where the question arises. So therefore, is there anything you could do to fizzle out the risk on your spouse, children and siblings when you go home every day? No idea. You can bring the disease from your workplace back home. Are you prepared for that? Or how do you prevent that happening? You have no idea at all. So therefore, there are a lot of questions which are going to be there for the next wave. So we need answers for all of these questions. Let us see how we could do. Now, as a preliminary step, you would have sometimes heard that the Sri Lanka Standard Institute has come out with a standard on COVID-19 safety management system. This was towards the latter May 2020. You can buy this particular the standard from this SLSI, and it is 1,000 rupees. Now they have given some methods by which the risk is calculated. Now, this is what I have shown here, right? So therefore you can go and then you can buy, you can follow the instructions given there, and you can get this accredited by assessors. There are some assessors now attached with the Sri Lanka Standard Institute who can come to your organization and do this assessment and tell you whether you have a risk or not. Whether you have a risk. That is what I have given here. But my approach is going beyond that. My approach, what I'm going to talk to you today, is more than what SLSI does. What I do is I will be basically calculating the risk based on a contagious subject, or in other words, infected patients on the basis of viral load in the mouth. Because whenever you become sick, you throw out different loads of virus, and the type of respiratory activity, breathing, speaking, whispering, shouting, exercising, all of these, under all these activities, the amount of virus that comes out from your mouth is different under different physiological parameters. Inhalation rate would be different for different activities. So taking all into consideration, there is a method that has already been developed. Now this is the method. Let us give it try to answer all these burning questions scientifically. This came out after May 2020. This is the paper that I have followed, and this famous lady, L. Moraswa, has produced this, and now you can calculate or estimate the airborne viral emission, right? Because this has now been measured. Up to until the May, we could not do this one. We were not sure how much is going out from our mouth, but it has now been quantified. Thanks to most of these scientists who are in this field, now we can be able to do. So that is, we call dependent on the contact calculation, right? It is based on the viral load in the sputum expressed as RNA copies. So in other words, you can measure whatever the viral loads that is coming out from your mouth, right? Then the question is, what would be the amount that is required to make another person sick, right? So that is given by quantum theory, which was not a very recent one, which has been used by many epidemiologists in the world. Or in other words, we define a contact, right? There is a certain, let's say, X number of viruses coming out from a mouth. Let's say a quantum 1. What it means is, one quantum is going to make 63% of the people sick. Let's say you are in an indoor environment with 100 people. Okay, you are the sick person. You throw out a certain amount of, let's say, a certain payload of virus, which helps to make 63% of the people sick. That amount is called quantum 1. So therefore, many scientists in the world make use of this because this has more realistic values coming out, because depending on your activity, you can calculate now the quantum level coming out from any one of mouth depending on the activity that particular person is engaged in. So with that, you can find out. Now, don't look at very much in this equation. Now, in fact, they have given this equation. ER is the quanta emission rate. In other words, a sick person throughout always. Now, let us look at, now I have been talking. Now, I have been talking means, let's assume that I am the infected. Right throughout, I have been throwing out the splatter. Now, this splatter has lots of contact. So therefore, my environment where I am is going to be full of virus. So that particular amount can be calculated using this equation, right? So it is dependent on many other factors which are given here. So all of these factors have now been estimated scientifically in the world. So therefore, we can now be we can be able to apply this equation for COVID-19 virus. Then what you do is, then you can be in your indoor setting, you can apply this as a nonlinear or the partial or maybe differential equation. Don't look at very much what is given there. What this says is, let us assume now I have been talking in my room, right? What I do is I will be increasing the number of viruses in my environment, in this endo. So how much I improve or increase with respect to time is given there. Or in other words, we call accumulation within the environment is given by this. And this is what goes out from my room. This is what I have, put into my room, right? So therefore, inflow minus outflow is equal accumulation. This is a very simple equation for many engineers, so that you know how to, solve this equation. Now, basically, when you just solve this, you can find out with respect to time, what would be the quanta level that is going to be present in the air for a given indoor settings from this equation. Most of these things are now known factors. I'm not going to go into each and every because of the time, but if anybody wants, can be able to ask so that I can be able to pass the information. So what I did was I calculated this n value with respect to time. Let's say for every minute we can calculate. So therefore you can be able to say, so with that, you can find out the risk, right? We can find out the risk involved in the indoor setting. So if you can calculate the risk from this equation, risk into number of people in that given environment or indoor setting would be equal to R naught. Finally, this is what we are going to do, calculate. That is called the susceptible number, or susceptible people is going to give you, in fact, the most important number we call reproduction number. Reproduction number is equal to risk into the number of people present in that particular environment. So if this R naught is less than 1, meaning you are 100% safe in your indoor, in your office space. Let us look at now what is R naught for different areas. Okay. For that, what you do is you need to calculate the quanta. Now you need not to calculate by yourself. The graphs have already come out in the world. Now you can be able to see there are a lot of graphs. Resting, standing, light exercise, whatever the activity you are engaged in, we can calculate how much you throw out from your mouth in RNA copies. That is what is given x-axis. From this you can get the quanta estimate from y-axis depending on different case. Now say if I take this one, it says voice counting CI 0.08. This is the amount of, or the fraction that is thrown out by asymptomatic patient, right? Asymptomatic, because we believe the asymptomatic or the pre-symptomatic people throw out only 10% of that of symptomatic patient. So this is for symptomatic patient. This is for asymptomatic patient. So in all our calculates, see, we get this smaller value. Why? Because we expect in our office spaces only asymptomatic people or pre-symptomatic people. So therefore they throw out splatter, but that splatter has less amount of virus compared to that of symptomatic patients. That is the difference that you need to know, remember. Okay, so with that, what we did was we did the modeling. Let us look at your office room. Now this is office room. Here you are in the office room. Let's assume you are now talking, you are the infected patient, right? Infected individual is you, right? But you don't know that you are suffering from this one because you are asymptomatic. 2 people come into your office. This graph says that. Now you enter to your room. At the same time, another 2 people come in, and let us see how the quanta level increase in your room, depending on air conditioning, ceiling fan, and natural ventilation. All 3 we have taken. How we are going to do is, we can calculate all these 3 into what you call ACH, air change per hour. So some of the people who are involved in this, the Indo, air quality predictions, they know how to get ACH for air conditioning, ceiling fan, natural. But look at the values. It is going up. We calculated using this equations that I shown earlier. R naught value less than 1. What does it mean? You are suffering from the disease, but all the other 2 are safe, right? Let's look at another scenario where you enter your room. You are going to be there for 20 minutes. After 20 minutes, the other 2 enter to your room, right? And in such a situation, we calculate R naught, which is more than that, right? More than that. Why? The environment or the indoor setting is saturated with virus now. But in a situation where it is saturated, another 2 enters, but still R naught is less, right? The third one, you are going to be there for 50 minutes, and then they enter, R naught is less than 1. You are going to be there for 110 minutes. They entered for 10 minutes, you are safe. That's why I say no risk for anyone. There is no risk for anyone. So therefore, basically we believe that given the circumstances where the ventilation is rather poor, you try to keep the people within your room for 10 minutes. Nobody is going to contract the disease. You are safe. So that is the norm. Always we tell the people. And look at next issue, next case, or the next scenario, same office. Look at the people who basically come wear surgical masks. Both of them wear surgical masks. So therefore, what will happen? Whatever the contact that this person's always throw out, these 2 also breathe. But because of the mask, they take a little going in. So therefore, that's why their contact emission rate becomes less, right? Contact level would be very less. Look at the values. Same thing. Still you're safe. Values are very, very low. Values are very, very low. It has reduced. Meaning that what it says, whenever you go to indoor, always wear the mask so that your threat or your risk is bare minimum. Look at what will happen. All 3 wear masks. All right. So then it becomes further down. Look at the values. Further down. So therefore, remember what it says. It is always better for you to wear at least the surgical mask whenever you are within the indoor setting. It safeguards you. It doesn't transfer much of this virus into you, right? Even though they are spread, within your indoor setting. So therefore, that would give you an idea. So therefore, in nutshell, what I want to say you is, in your office, if you can entertain less than 20 minutes of people, you got to be safe, and your people who visit you are to be safe as well. So therefore, keep that in mind. That prevents the disease being spread out in the other areas. Now you're going to auditorium, right? So, because you know that in sometimes you have to, go to auditorium, you have to, discuss with a large gathering. In such a case, let's look at the first one. You have 100 people in this, right? And there is only one infected person. The person who talks is, let's assume he is the infected person, and you have a kind of a lecture or maybe a talk of 60 minutes, right? 60 minutes with air conditioning, ceiling, natural fan, all on. For all cases we calculate. Look at the R naught value, 11.5, 11.4, someone. So meaning, what it means? Pretty dangerous. Or in other words, if a person is going to talk there, the patient is going to talk for 60 minutes, out of 100, almost 12 people become sick within 1 hour. See, within 1 hour. Now, what will happen if you go for 2 hours? The level goes high. If you are going to be 3 hours, 33.84 people are going to be sick, right? So therefore, that is why. But look at the number. Whenever you have a natural ventilation, there is a trend. Whenever you have a natural ventilation, R naught value decreases. But the question is, do you have enough natural ventilation to give ACH of this amount? Very rarely. Because if you don't have the cross ventilation, you don't get this amount of ACH. So therefore, I don't believe the natural ventilation in many indoor settings. You got to basically be dependent on ACs, right? So without that, there is no any other alternative in many settings. But there are certain offices where you can enhance the natural ventilation. When you say natural, I believe it is cross natural ventilation. Anyway, when you look at this, see, you are at a very high risk if there is an asymptomatic patient. Okay. Now what will happen? You let all the people wear masks, surgical masks. Look at the R naught value. Still it is high, greater than 1. See? So meaning that at least 1 or 2 people are going to be sick, so that the disease will spread. So therefore we call it, you are still having high risk for your employees. Okay. Then what we are going to do is we are going to, reduce the number that you put into auditorium to 50, right? You put it into 50 because you are maintaining this 1.2 meter per person, or in other words, distance would be like more than 1 meter, right, between two. So you have half people within the auditorium. Look at the values. No mask, still high. Look at the same, with mask. Now you have reduced certain, but still you have the high risk for the employees, right? What does it mean? Try to avoid mass gathering within your institution. Even though you believe that the people are, allowed or maybe asked to wear surgical mask, that would not help you combat this disease being spread. So therefore, ideal would be to go for a smaller crowd and always look at the number of, the minutes that a person is going to talk. So if you can make it shorter, that would help you a lot. So that's what we have done here. It may not be practical sometimes. It may not be practical, but I just want to show you. Look at this case. A person talks only 60 minutes. Person talks 60 minutes. And look at, he starts, spreading the virus, goes up and up and up, and then saturated. We say it has come to a steady state. It has come to a steady state here. After 60 minutes, what you do is you ask all the people to go out, break. In the case of break, all people going out for 30 minutes, then what will happen? The viral load within the environment drops because there is nobody, right? Nobody is shedding the virus within the environment, so that it basically drops. And after 30 minutes, they again assemble. So therefore, in such a case, R naught is almost 1. But still you have a moderate, but you can see it has drastically dropped. So the question is, is this practical? Sometimes you feel that this is not practical, but if you can have your meetings, whatever your gatherings within short intervals, that would help you prevent this disease being, transmitted to other people. So therefore, keep that in mind whenever you work in auditoriums. Then comes conference room, which is very common in your workspace. Not a big gathering, but you have like 10 people. Like usually between like 0.5 meters, you have 9 people, but one is, contracted with the disease. Look at with the time. With the time, the R naught value. If you are going to be here for 30 minutes, R naught is 1.64. 60 minutes more, 120 minutes, 180 minutes, you can be able to say great numbers. All these numbers belongs to this 9, right? Out of 9, almost 8 people are sick. If you are going to be there for 180 minutes, right? Then the question is, what we should do? Look at this. You provide them surgical mask. All of them wear surgical mask. It's compulsory. Still 30 minutes fine. But when you go for 1 hour, you are still susceptible. So we don't let this happen, meaning that you have a moderate to high risk. These are anyway out. So therefore, even this situation seems to be not ideal for you. So then what you do, you just make the people half, right? So you're going to now maintain 1 meter distance. Earlier 10 people, now 5 people within that, the enclosed area. Look at the value. Still, you have a high level because they don't have mask. Now let us give them mask. Whenever they have the mask, can you see the number reduced? So therefore, now you can go up to one hour without any issue, right? So for this, whenever you have a conferences, whenever you have a frequent meetings, make sure that you have like 1 meter distance between people, and all the time each and every person should wear the mask and do not go beyond 60 minutes. Always give them a break after 6 minutes, and then you can again assemble within the same environment, and then you can go ahead. So therefore, keep this in mind. And I have seen in many workplaces, this never happens. Now what you do is you maintain 1 meter distance, but since you're inside, you tend to remove your mask. And whenever you remove your mask, there is a very high risk that has, arisen within that given environment. So therefore, never do it. Let each and every person wear the mask. Never allow them to remove the mask, but always try to restrict your meetings to a short intervals, less than 60 minutes. Then you are safe. Then comes to your office space. So you are in a large area. Now this is, international, the standard is like you are having 1.5 meter, 8 square meter per person. And if you are going to be there, look at, we have like 30 people within this spacing. And then you are going to be in your workplace for 8 hours. No point in, modeling less than 8 hours, because there is no workplace where you can go and then work for 2 hours, 3 hours or 4 hours. Earlier there was, but now that system has been completely changed. So therefore you got to be in your office for 8 hours. If you are going to be there in 8 hours, look at that note value. It's pretty high. This is for 30 people. Then what you're going to do is let people wear surgical masks. So in such a case, still the R naught value is greater than 1. Still you have a high risk. Then let us make the people half. Now only half of the people who occupy your office are there. Not all people, only half of the people are there. That is 14, including the disease, including the patient, or altogether 15. Still R naught is high. Why? No mask. Let's give them mask. Now they are wearing mask. See, you have no issue. So therefore, remember, it's always better if you are going to be in your office space for more, more than 8 hours or even a longer period. Make sure that each and every person wears a mask, and also you maintain a distance of a little more distance. It's roughly like 3 meters distance, and then you are safe. Otherwise, some of your employees do have a greater risk of contracting the disease. And then you go to cafeteria, right? So people would like to, go to cafeteria because they don't want to be in the office right throughout. Whenever you go for cafeteria, so you basically stay there for 30 minutes. If you're going to be, there in 30 minutes, you have altogether 30 people in the cafeteria, 29 and one with one infected. But remember, can you be able to have mask here? Not at all. You can't eat with, simply by having a mask. So therefore, you got to believe that the people are not having mask. In such a case, R naught value is greater than 1, meaning you have a high risk. What you're going to do now? You take the people, only half of the people than what you had earlier. So in such a case, you maintain 2 meter distance between people. Look at the value. There is no problem. But do not ask people to wear a mask, because no point. In a cafeteria, you cannot have the mask. I've seen that some people are, wearing masks, and let people, not have the mask and then, enjoy their meals. But how you are going to make sure that you are safe? It is basically by having a distance of more than 2 meters between people. So then you try to restrict the, the time interval that each and every person stays in the cafeteria. Sometimes you believe that you need not to be there for more than 30 minutes. That is much better. If you can finish eating within 10 minutes and go back, that would be ideal. So therefore 30 minutes would be maximum, but never ever increase this particular, the total number of minutes. If you are going to make it more, your risk would be fairly high. So therefore that will be easy for you to understand. You try to eat pretty fast. The faster you are, safer you are when it comes to COVID-19. Then you go to lunchroom. So every person doesn't go to the cafeteria now. So what you do is you bring your lunch from home and you go to lunchroom. So you assemble with people. Let's assume that in your lunchroom there are altogether 10 people and one is affected with the COVID-19. All other 9 are not there. So look at here again, no mask. You cannot eat with mask. And if you are going to be there in your lunchroom for 30 minutes, you are going to be sick. At least 2 people would be subjected to the COVID-19 virus contraction. So look at 60 minutes, fairly high. Why I have considered 30 and 60? Some people do stay long hours in this lunchroom chatting, right? So therefore, even here you try to finish your lunch as early as possible. But this case is anyway not acceptable. Then what is acceptable? Make it half now, like earlier cases. Now you have a distance of 1 meter. Earlier we had 10 people. Now you have only 5 people in the same area. You can be able to say still you have a moderate to high risk. Why? No mask. So therefore this is again going to be an issue. So therefore my advice is try to stay here only less than 20 minutes, or ideally if you can finish it within 10 minutes. So therefore you are safeguarded. Okay. Then whenever you are in the office space, definitely you need to go to washrooms. Now whenever you go to the washrooms, and it is again dependent on the time interval that you're going to stay inside, and make sure that most of these washrooms do not have a proper ventilation. And the area where you have the poorest ventilation would be most of the washrooms. If you maintain 1 meter distance, see you have altogether 6 people, you have no risk until 10 minutes. Can you see up to this level, you have no risk. But moment you are going to be more than 10 minutes, you are at a risk, right? Why 10 minutes? Usually whenever you go for a male washroom, people are not going to be there for more than 5 minutes. But when it comes to female, employees, what happens? They are going to be there in the washroom, so even more than sometimes 10 minutes. Why? They have to apply makeup, right? They have to comb when the time is about to finish. They have to do makeups. So many activities are going on when it comes to female employees. So therefore, they tend to stay within the bathrooms or the washrooms more and more. So therefore, they are more susceptible to this coronavirus within the office washroom. So therefore, as long as you stay there for a very short period of time, if you can make it, within, let's say, within 5 minutes, or I would say maximum 10 minutes, you are safeguarded, absolutely no issue. But again, I just wanted to see what will happen if you just half. You have absolutely no problem. Say, for example, if you want to be there in your washrooms little longer time, make it sure that you have less numbers within the washroom. Now here, 15 minutes, still you are safe. Your R value, R naught value would be less than 1. So therefore, this is ideal for female washrooms. Right? If you want to be there for a longer period, make sure that at any given time you have lesser number being present within your washroom. So therefore, you can be able to, basically your life is safe. Right? And then again, same thing, sometimes you can be able to do with, mask on. And I would always recommend you to go to your washrooms with the mask on. Why? Ventilation seems to be very poor. Now, I have taken some of this ventilation here as, ACHS 3, but most of the places I have measured, it is less than 3. So therefore, it depends on your actual situation. So therefore, always whenever you want to go to washroom, my advice would be always wear the surgical mask and never remove it. Never remove it, because if there is a patient, your viral payload would be very high because it hangs around. It hangs around, and it is active for a couple of hours. So that's why we need this to be practiced within your office space. Once you finish your office, what you do, you get into your car and then you come back home. And whenever you do, what you do usually is you keep on, switching on the AC. You don't want to, you need comfort. So we switch on your AC. Now this is what is going to happen usually in the AC. Okay. So that you can be able to see. What will happen if there is an infected patient in your car? So let's say you have 4 people. We have calculated R naught value would be very high. Or in other words, all the other 3 people contract the disease. If you are going to be in your car with the AC on for more than 30 minutes, all the 3 people are going to, get this disease. So therefore, you have to be a bit careful. Look at what will happen. Even though you have a surgical mask, still R naught is more. Even if you have the N95 respirator, R naught is more than 1. Right? So therefore, what in other words, what I want to say you is, whenever you come out, if you feel or if you suspect that there is a person in your car suffering from COVID-19, ideal would be not to switch on AC. Ideal would be open all 4 windows, and this is the flow line, how it comes to you. But without a mask, there is a possibility of R naught getting high, more than 1. But in some cases, it is not so. The classic case that I can give you is, look at the first index patient in Sri Lankan origin, our tourist guide, right? And the tourist guide has gone to see a doctor because he got some symptoms, and doctor identified that he may be suffering from the COVID-19, and he was requested to go and get admitted in Angoda hospital, right? And from this place to Angoda, it has a travel of more than 30 minutes. And he got into his car, and his son drives, and the son drove the car, and then the other side, his wife was there, and this patient sat behind the these two, and then that is in the back seat. And what he did was he opened all 4 windows, and then they drove to the hospital more than 45 minutes. None of the other 2 got contracted the disease. Now see the example, ideal classic example, right? So he must have not known the theory behind this, but he would have done this thinking that it would help other 2. So therefore do that all the time. If you find that somebody is there, you know, suffering from the COVID-19, do this one. That helps avert the entire scenario. Or sometimes even you may go home alone, right? Because you are then become a carrier of COVID-19. So therefore it would be very good even if you can do this one, if the circumstances allow. Say sometimes in the middle of the traffic, you may not be able to do this one because of the heat, because of the dust. But if it is possible, you try to practice this as much as possible. That prevents from getting the disease for the others. You are not transferring disease to your loved ones at home. So therefore try to do this as much as possible. In that case, you can see R naught value is less than 1. Absolutely, you're very, very you're very, very safe. So try to do this as much as possible. Then answers. So this is the last part of my lecture. So given the situation, what I explained, what I want to say is, do we need to reinstate good practices of all type of hygiene recommended by your institute? Yes. But remember, but not alone adequate, right? And always I say masks are necessary so that the ventilation capacity are assumed to be equivalently improved, right? And also say must be practiced always indoor. Is this happening? Not at all. Whenever you enter your office space, what you do, you clean your hands, you clean your shoes. Sometimes you remove your shoes, but you go in. But whenever you come out, you never do this again. But unfortunately, remember, the threat is more within the indoor setting. So therefore, theoretically speaking, whenever you come out from your office, you must clean your hands, clean your shoes, whatever possible. So always, apply or reinstate your practices, the social etiquettes or whatever within the indoor environment. That helps you a lot in preventing transformation of the disease to others. And then next one is switching off air conditioning. I said good, provided that you have adequate natural cross ventilation. This is what is not happening. When you look at this picture, this is what I meant by cross ventilation. You have opening in the either side. You can see, you can feel that the air comes from one end and it passes from the other end. But this situation is very, very rare nowadays in our buildings. So therefore, invariably, we need to go for ACs. It's going to be very difficult for you to go. That's why I say not plausible. Only option available in many office space setting. Hence, go ahead with other engineering interventions. You have to now go with other engineering intervention. Why? Your AC alone will not help you at all. Why? AC, sends you cool air, and at the same time, hot air will be taken back by the same AC through the filter. Now, this filter doesn't have HEPA filter. That since that ability is not there, what your AC does is basically it sends you back half of the air full of virus. So therefore, whenever you switch on AC, you got to believe that it sends you air, cool air, fine, but it is full of virus, because whatever the filter in your normal AC does not filter virus. You got to have HEPA filter, then only it will remove virus. Now say if you are in an airplane, you have no issue. Why? Airplane ACs has HEPA filters. If you are in an operating theater, you have no issue. Operating theater ACs have HEPA filters. So therefore you are safeguarded. But unfortunately in your environment, your ACs would not clean up the virus. So instead of that, that would add an additional load than what the infected patient sheds out. So therefore, we need to go with other engineering interventions whenever you have ACs. The next question is open windows for natural. Need to estimate and see the flow rate. So engineers can calculate ACH, but my answer seems to be the best option if possible, but no provision in many settings. Unfortunately, we don't have, this particular facility to have the cross ventilation. So in such a case, no point in having natural ventilation. It would not help you at all. Then the question is switch off ceiling fan. Yes, that would be better, because ideal to be combined with cross ventilation. If you have the cross ventilation, ceiling fan would be helpful. Otherwise, what ceiling fan does is it circulates the entire contour that is within that environment to each and every. Right? Let's say I'm the patient, I'm in one corner, but whenever you have an AC, what it does it brings whatever the payload that is basically be shed out to all the others equally. Right? So in other words, that would help transmit the disease to all the susceptible people within that indoor air. So therefore, if you can switch off ceiling fan, I would recommend for you to switch off the ceiling fans if possible. Right? If possible, if there are no ventilation, people may not be able to work without fans. So in such a case, you need to go for that. Okay. So what all of these things tell you, you do not have a proper environment within your indoor. So then what you need some kind of engineering intervention solutions. Now these are what you can do. And in most of the countries, people go for what you call the mask with HEPA filter. In Sri Lanka, we got some, but they are no more available because the people buy pretty fast. So therefore, you may not be able to find this immediately, but they are under mass production. And I do believe that in time to come, you will be able to get some of these HEPA filters for you, so that would prevent quite a lot. So then in the absence of HEPA filter, what we can do, we can go for this, what you call the plasma ionization unit. This is portable unit, ideal for the areas where there are no ACs. Right? What this does is, whenever you keep this one, it sucks in all the air. Now this air has virus. The virus plus the air will go in and it filters, and also it has a plasma ionization that kills bacteria and virus. So therefore, coronavirus is basically inactivated, killed when the air passes through that, and in addition, it has a HEPA filter and it filters as well. So therefore, there will be double guaranteed inactivation through this unit. You can buy this in Sri Lanka, and then the Sharp has introduced this very much. And right at the moment, we do from the University of Moratuwa, we do work with these private sector people, and then there is what company called ABC Traders. Mr. Jayasilan is also now joining here. So he has brought this, and then the university, we just do all the checks, whatever the possible checks, together as a certification, and then you can make it available so that if you are in a risk area, you can have this one, so that your risk factor could be minimized. But you cannot simply go to the let's say for a shop and then buy this one. You have no idea. So therefore, if you are to buy this one, get it assessed your environment, and then only you should go for this type of equipment. Otherwise, you basically you look like blindfolded. You have no idea. And whenever you have a good AC, and we recommend what you call this bipolar ionization unit, which is the novel technique used by many countries now for coronavirus. What it does is it emits oxygen radicals, oxygen plus and oxygen minus atoms from the molecule. They produce atoms, but they are charged atoms. These charged atoms go and then hit the virus, and then since they are very good oxidants, so they just go and then just damage the corona of the virus, so that most of the virus become dead, or we call inactive. So this small unit can be fixed to your AC very easily, and it is powered by a DC current, And once it is done, it not only kills viruses, it purifies your air, indoor air as well. Now this, depending on your area, we have different sizes, right? And you have a minimal, I would say, maintenance for this one. And once it is done, so you can be able to, measure the ionization levels. We do measure the ion levels. If there are more ions, meaning that your environment is much more clean. So the people ask whether we can be able to go for UV or maybe ozonation. I have some reservations for these two. Unless you are 100% sure, I do advise not to go for UV, C radiation, the radiations, and also the other one is ozonation, because both are not good for human beings. They would cause cancer. But there are certain good, the equipments nowadays coming out, which are better compared to what I said. It may not be there, but I would advise you look at the possibility of other ill effects that you would get simply by having these, units. So that's why I do recommend basically plasma ionization units and bipolar ionization units, which we have, fixed in many areas. Many officers, and I have done it for dental settings. Many dentists, fix these units, because dentists are the people who are more vulnerable compared to all the professionals. Why? Because they have to, do their activities simply by opening the mouth. And at the same time, they do produce aerosols, right? So therefore, they are the most vulnerable people as far as all the people are concerned, the professionals are concerned. So we have fixed some of these things there. So therefore, you cannot go and then fix easily. First thing, you need to go and then do this measurements and then find out what is this R0 value. Depending on that, we have to fix it. So that is how the engineering solutions help you avert your problem. If you are going to have these units, if you are going to have, maybe ventilation increase, meaning that your next wave would be cut off completely. So therefore, that is what we can do. So in a nutshell, these are the, I would believe that these are the interventions that you should be able to do in your settings, in your indoor settings, workplace. Adapt guidelines explained above as much as possible. Avoid the mass gathering as practical as possible. Wear PPE, or in other words, mask. Use adequate hand hygiene practices while in the office and when coming out of the office spaces. That is most important part. Use appropriate ventilation improvements. You can have mini air suction devices, HEPA filters, exhaust fans, forced ventilation devices, all can be, fixed. But how? You must make sure that you have your ACH level in your office spaces greater than 12. This is what is given by WHO, right? So you can measure in your workplaces what would be your air exchange change, and it has to be more than 12. If you can produce more than 12 ACH, meaning that your area would be safe. And use bipolar ionization technique if you want. Clean all surfaces with an alcohol-based disinfectant whenever possible. This is very important. Why? Whenever you work in the office space, you produce splatter. You produce the basically aerosols and droplets. So droplets go and then fall onto these objects. Unless you clean your chair, maybe your the table or whatever the objects around you, you are more susceptible. So therefore, clean them. How often? Remember, at least once in 3 hours, right? Don't think that you can clean in the morning and maybe in the evening. Enough. No, every 3 hours, you got to clean your surfaces, right? If the people come and meet you. If not, no problem at all. You don't need to do it. But if frequent people come and meet you, every 3 hours, you got to clean your, the objects around you. Remove and keep all your disposable PPE in a container filled with disinfectant for at least 24 hours before disposing. Do not throw out your used mask in your normal garbage bin. That would help, transmit the disease to others. Why? as I mentioned earlier, the active virus can be there for 7 days. So what will happen whenever the humidity is going to be less and humidity is high in our environment, so therefore vaporization takes place so that the droplet nuclei will go out. Now say whenever I speak, droplets goes and then falls, but it never stays there. The viral can be airborne from these masks. So you have to be very careful. So therefore do not throw out the used mask as you throw out your normal ordinary garbage. Or anything you feel comfortable but scientifically proven, do it. Otherwise, I have my reservations. You got to make sure, always there are so many experts here now available in Sri Lanka, contact them and request them to, give you opinion, and you gauge whether it is plausible or not and do it. That would help, prevent this COVID-19 transmitting from your office to other areas. So last, I just want to, thank all of you. Let's build our workplace setting risk-free. That would help a lot. Because if you don't do this one, you let, the patients in our community go high. If it is going to be high, nothing can be done. Nobody can be able to prevent this, going to all the other areas of Sri Lanka. So as long as we are best in our region, as I mentioned earlier. So let it continue. For that, your support, your contribution is of very much importance. Keep that in mind. Thank you very much. I think we can take some of the questions.
Yes, sir. Good evening.
Yes, good evening.
This is question and answer time. We have some questions, sir. So, Professor Madam Ratnayakar, please present your question, madam.
I already sent it to you. I thought you were going to ask.
Yeah. I have already forwarded to Madam, sir.
Yeah.
Professor Mahesh.
Yeah, my question was actually about the asymptotic.
Asymptomatic, yes.
Asymptomatic, yeah. COVID patients. Is there a time now? Can they be still infectious after the incubation period of 2 weeks or 3 weeks? Is there a time during which they are infective, or is it like this rule that
when you have a asymptomatic do not have incubation period, right? Because they never show up any signs. Now the incubation period applies for the people who are pre-symptomatic, right? Meaning that they will show up the signs and the symptoms between the day 2 to day 14. Okay, so therefore then they become symptomatic, right? They become symptomatic. So therefore meaning of pre-symptomatic means definitely they are going to be symptomatic, but after some time. But
I understood that. But asymptotic means the virus can be there in your body forever. Is that?
No. They are going to, they are there only for some time. But how long? Nobody knows. It is a question nobody could answer at the moment.
Okay.
Because we don't know how long it is going to be there. It has not been yet found.
Thank you, sir. Thank you, madam. Is there any questions? So you can present it now.
Professor Mahesh, can I ask a question?
Yeah, go ahead.
Yeah. So you were talking about the CV value in contact?
Yes.
Yeah. So is there a temperature dependency of the CV value? Let's say we release some of the whatever the aerosol to the different temperature environments. The CV value, is that going to be different?
It is a very little impact on the temperature. We did actually the modeling. In the sense that quite a lot of the engineers did modeling, and there is not much difference in the CV value when it comes to temperature. So therefore, you need not to be that much worried of the temperature when it comes to CV. Okay. It is more or less same. Or in other words, it is insensitive.
Okay, okay. Because nowadays they are talking about that whatever the virus is sensitive to the temperature, right? Is there a truth in it?
It is actually not within the indoor environment. It is basically in the outdoor. If you look at the country-wise, yes. Why it is important is you're going to look at the difference between the maxima and the minima. So that difference matters a lot. But fortunately in Sri Lanka, we are at a high temperature. Our diurnal changes, that is the difference between day, is very minimal. So therefore we are very much safe when it comes to temperature. So that you need
Okay.
not to worry in Sri Lanka.
Okay, thank you, sir.
Yes.
Thank you, sir. Is there any other questions?
May I ask a question?
Yeah, go ahead.
Yeah, proceed.
Yeah. Apart from what we have discussed, I have seen a product which helps to isolate when we talk each other, especially when it comes to a face-to-face discussion. It's a kind of a separator. It's a transparent separator. I'm not very sure about how much it helps to prevent
Yeah, that's
scenario
called,
what we are facing. Yeah,
that's called
I
the
just need.
okay. So that's called the shield. The shield would help you basically prevent the droplets transmission. Say whenever you work very closely with the people, always it is good for you to have a shield. Whenever you see, whenever you walk, whenever you travel in the road, you can see that most of our police people, the policemen wear the shield. That is important, provided that you have a direct contact, right? So therefore, in a workplace, I don't think that the shield would help you at all, because the shield cannot prevent aerosols being taken in by you. It is not to prevent aerosol, but that is basically to prevent only the droplets splashing on you. Is it clear?
I think the
Yeah, but
caregivers use it, no? Caregivers and those who are looking after the patients.
Yes, that is ideal for them. Say, for example, healthcare workers, those who are in the front line, definitely they need to wear this one. That comes under their one of the essential PPE. That is to prevent from getting this droplets, or in other words, direct transmission can be cut off very easily if you have a shield.
Hello, Professor.
Yes, go ahead.
Yeah, can you hear me? Vimal from Oman.
Yes, go ahead, Mr. Umar.
Yeah. Actually, I also got affected. I have real experience regarding the COVID. I got affected 2 weeks back.
Okay.
You see, they have done the test. It is like body pain sort of things appeared initially.
Okay.
So doctor gave antibiotics. That's it, like mild, what we call cold only. It is a very nice experience. It is not like the what we are experiencing, but that is my real experience. So with that, I would like to ask, what was the major cause? We are talking about the controlling and so many things and all. What was the major cause for this viral effect?
This is actually, the cause is not yet found. We don't know what are the causal factors, underlying factors behind this virus. Nobody knows yet. People are still working to find out. So it's not easy. But as you mentioned, now you become, in fact, a victim of COVID-19, but you have not noticed much signs and symptoms. You have mild condition. This is what I started saying initially. 99% of the people who have contracted disease, suffer from only mild conditions. That is why in the West, in the other Western countries, people take it for granted. And they consider this to be another, common flu or the common cold. They don't consider it to be very serious. But when it comes to Sri Lanka, we do consider very much. Why? Because we are worried of that 1%. We don't want to have the deaths. Because our system, I believe the system is much more improved compared to others. And it is because of the fact that we give everything free.
Yeah, one more thing, this, second time test was, carrying out in Sri Lanka, but here, as per the WHO, the first time the symptoms, test after 14 days, there is no symptoms, no need to carry out the test. Is that true?
Not really. It is not true, because last week there was a new paper coming out from the Journal of the New England, and they have tested positive after 21 days. After 21 days, it has become positive. So therefore, some things that we know is very minimal when it comes to COVID-19. Things that we don't know about COVID-19 is massive. That's why people are doing quite a lot of research. This would be, again, you can contract this disease again and again. How many numbers? Nobody knows. And there is only one evidence saying that one person has contracted the disease 3 times. That is the only thing that I have heard. One has contracted 3 times. But the scientists believe that it could be more than that.
Yeah, all over the world, what is the major reason to spread by air or the consumer goods or human mobility and all like that?
It's basically from person to person, that is through direct contact, through droplets. That has been already, confirmed by many scientists. So that is why we have lots of interventions. That's why in Sri Lanka is one of the best countries. We have had quite a lot of good interventions. Those are usually called non-pharmaceutical interventions. We have been practicing that prevents this disease from spreading to the other community people. As I mentioned, the most important factor is do not pass this to community. Then you can do contact tracing.
Yeah, indoor environment, we are talking about the aerosol, by aerosol, by air. But the outside, when you go to the world, the worldly spread, so it is not by air.
Not at all. Because why it's not air? Because whenever you go to the outer environment always has a high dispersion of airborne virus. So therefore, in no time, all the viruses become airborne. It's not available for you to breathe. But whenever you are within inside settings, what happens is it always circulates within your enclosure. So therefore, you are more susceptible to breathe the air rich in virus.
Yeah, for example, when now it is AC design, when it is coming to AC design, as you said, is the HEPA filters going to be mandatory as per the COVID standards? The economic wise, the cost wise, it is, again, this, going to be factored.
Not really, because we cannot mandate so still nobody has mandated the HEPA filters. But what we say is it is preferable if you can go for even ACs with HEPA filters. That would help you, prevent getting this air with more viral loads.
Yeah, one more question. When we, air filters is one flow directions only. It is not disturbed. When we, wear the mask, it is 2 flow, in breath, out breath. Like a backwashing, it is happening. So, does it? The infected guy or outside, it is a 2-way direction. The air passes. Does it really, act as a filter?
Yeah, that's what I explained earlier. Say, for example, you wear this mask to protect yourself. What you do there is basically you let the mask fit to your face, so that all the viruses coming to you will come through the mask. But whenever you have, let's say, a surgical mask, and there are lots of leakages, so therefore the air will come through even the leakages. If you wear this mask longer period, basically the filter efficiency become minimal because it is soiled. Or your splatter, whenever you speak out, the splatter that comes out from your mouth will go and then deposit on the inner layer. So because of that, your filter ability reduces drastically. But still you have to basically breathe, meaning that air will come from the leakages from either sides. So therefore, it is look like that you have had no mask. So no point in having the mask after that. So that's why we say that every 3 hours you got to change your surgical mask.
Yeah,
So I'm an engineer from manufacturing field, and we are getting some containers from India, and within 48 hours those containers reach our factory. And is there any threat to open and go inside with mask, including, I mean, though with the mask, is there any risk?
I would believe you if you wear N95 or KN95, you are not going to have a very high risk. But if you are going to go inside with only the surgical mask, yes, there is, because we don't know, because whatever comes from India, because there will be a transfer which is called the fomite transmission. It is very plausible, because this virus can be there for sometimes even more than 3-4 days, depending on your the surface. So therefore I would advise you must wear definitely N95. Why? Because most of this nuclei, the viral nuclei that was attached to the surfaces of what you get, it can be airborne, right, within these containers. So therefore you will be basically inhaling. That is what you should stop. So for that, best thing is to wear N95 and go and then do the whatever the checks.
Thank you,
Didn't gloves help, Professor Mahesh?
Gloves help to stop only fomite transmission. Fomite transmission, yes. Gloves.
Yeah, in this case, where you are expecting some of that, no, in the
Yes.
stuff that is coming from
Exactly.
India.
Yes. Now, whenever you want to go and check, you have to have the gloves, and you have to have what you call this KN95, mask. If you have both of them, you are safeguarded from 2 types of transmission. One is airborne transmission, the other one is fomite transmission. So do it.
Thank you, sir.
Hello, good evening, Professor.
Good evening.
I'm Charid. Professor, my question is regarding the bipolar ion emission treatment technology that you introduced in the presentation. So is there any harmful effects to the people who are within an enclosed environment by using that technology?
Not at all, because it has been thoroughly checked by many scientists. There are quite a lot of new papers coming out on that. What it does, it produces oxygen radicals. These oxygen radicals go and then join first with the water molecules, and the water molecules will be converted to hydrogen peroxide, and also the hydroxide, that is OH radical, OH minus. So these two would go and then always denature the protein structure of the viruses and bacteria. But they cannot do anything for humans, right? So therefore, that's why we say it is quite good to have in our environment, because you have ionized air in our environment. So that would prevent the virus or bacteria basically be thriving. So therefore, there are quite a lot of literature available nowadays in the internet. You go there, and then you can be able to find, or even if you can contact ABC traders, you get all the information.
Okay, thank you very much.
Sure.
Thank you, sir. Is there any question? Okay, then thank you. Professor Mahesh sir, all members of IESL, all members of SLAs, and ladies and gentlemen, good evening. I am Engineer Kushni. On behalf of WF and Section C of SLAs, thank you for all your participation. And this type of study is very much important during this period. So we pay our gratitude to Professor Mahesh Jayavira and the team for their informative and very interesting subject findings. And now we know that how the COVID-19 virus transmits in indoor workplaces and the impact of different ventilation systems and the effectiveness of use of masks and infection risk from symptomatic patients to other employers, and also the risk minimization methods. So I'm sure all are aware of this global threat in detail. So we are very much grateful to you for accepting our invitation with very short notice and sharing your valuable information with us. And our former president of IESL, Professor Madam Ratnayaka. Madam, thank you very much for your initiative to arrange this lecture. And also our committee members and the IESL, thank you for your commitment. And I must mention about Ms. Devika and the team of WF and SLA's officials for organizing the event, and all members of IESL and all members of SLA and any other participants. Thank you very much for your active participation. Good night. So thank you very much, sir.
Thank you very much for inviting me, and then thank you for all the participants who have joined. I do believe that you have got enlightened of some of these issues, how to resolve. Thank you, and then you can contact me, say if you need further information. We from the University of Moratuwa, give all of these things free of charge. So if anybody wants further analysis, the estimations, everything, you could be able to, you are welcome to, contact me at any time. Thank you very much.
Thank you very much, sir. And thank you. Good night all.